Hi, I'm Dr. Edward Gross from Primera Plastic Surgery. I'm a double board certified facial plastic and reconstructive surgeon. I trained at BU and Tufts University. I also trained at Indiana University for my fellowship. Been in practice now for 25 years here in Lake Mary, and we have a full operative site here, Quad ASF Surgery Center, and we provide all services under one roof, including our med spa, our surgery center, and then our non-surgical suite here, where we do the Botox, the fillers, and the lasers. Of course, I focus on doing the surgery, and that's my passion. I've been doing this now for 25 years, and it's fun changing people's lives. I wanted to go into plastic surgery from a young age. My father was my role model. He was a primary care doctor, so for most of my young life, I saw him as a role model. So I knew I was probably going to go into the medical field. Once I got into medical school, I did some rotations in the plastic surgery department, also in the ENT department, and it was kind of an instant desire that I had because I was helping people and seeing the changes that we were having on people's lives. Super happy I went into plastic surgery, but specifically facial plastic surgery, because I like to see all my work, it's out there up front, and you know, this is the focal point whenever we see somebody, focus on the eyes and the face. All the work and the delicate work that we do here is front and center for everyone to see. Central Florida's been a great community for us. We've been blessed to do very well, and I feel a responsibility to give back to the community and support the area because our staff and our practice has grown so well here. We're always offering pro bono services through the domestic violence shelter, Safe House, Harbor House, working with face-to-face program. So I do enjoy giving back, and even Camp Boggy Creek, I volunteer out there in the summer. But Central Florida's really been a great place, and it still continues to grow. And I would highly recommend it to anybody, either for residential living or working. I am considered more of a homebody. I deal with the public on a daily basis, so I do appreciate my private and alone time with my wife and our little doggy, Bailey. And then a little bit of golf, maybe, going to the golf range in the afternoon, hitting some tee shots off the range. That would probably be my ideal day off.